Hi, my name is Amber and I'm a student at the University of Louisiana Lafayette.
My name is Keith Dalton. I am an outpatient physical therapist at Iberia Sports and Rehabilitation.
How long have you been a physical therapist?
4 years, and I've only worked in the outpatient setting.
Why did you choose that setting?
I mean, the best opportunities to work with athletes as well as geriatric and orthopedic patients is I work outpatient, and I'm also an athletic trainer. So Friday nights, I also go cover football games. And wound care is another area that you can work. The results are they're right there, because it's either healed or not.
What's the typical age of your patients?
My oldest patient has been in their mid-90s. My youngest patient here was 7 years old.
What injuries do you treat most often?
The shoulders and knees and low backs.
What tool do you use most when rehabilitating?
My hands. I'm either doing traction, I'm doing things with my hands.
What special equipment does this setting have that most settings don't?
We have a traction machine for cervical and lumbar spine. We also have interferential current machines with ultrasound. Those are things that you use mainly in the outpatient. You don't see them a lot in the hospitals or nursing homes.
My name is Jacob Freyu. I'm a physical therapist and I work at Iberia Medical Center.
How long have you been a physical therapist?
A little bit over 13 years.
And how long have you worked in this setting?
So my entire time. Being able to work with the hospital, I get to do acute care and home health, so I get multiple environments. At Parish Hospital, we see every type of insurance from Medicaid through private Medicare, workers' comps. My youngest patient has been 2 weeks old. We do quite a bit of pediatrics, so we're different than most clinics, most places. This patient has been just over 100.
What is your favorite tool to use in therapy?
My hands.
What equipment does this setting have that other settings don't?
Outpatient setting has the most equipment. Inpatient acute in the hospital, we just go from room to room. We use walkers assisted devices, but we don't use a lot of supportive equipment. Inpatient rehab has some equipment like the mat you're on, some of the wedges.
Salaries have a large range, anywhere from 6 digits for people working as administrators to people who own their own businesses, down into probably mid-40s. So large range. The biggest issue is if you work where nobody else wants to work or in a setting that nobody else wants to do, that's where you make your money. You have to be willing to kind of do the dirty work a little bit.